Good afternoon and welcome to the 2020 Children's Budget Summit. I'm Michelle Dallafor, Senior Vice President for Budget and Tax Policy here at First Focus on Children, and I'm excited to share the release of our 2020 Children's Budget Book with all of you today. We are living in challenging times, and so in response, our annual Children's Budget Summit is coming to you virtually for the first time. All of us at First Focus on Children hope you and your loved ones are doing well in this uncertain and difficult year. Our country is experiencing a once-in-a-generation pandemic, devastating economic decline, back-to-back climate and environmental disasters, a national movement to address racial injustice, and a divisive national election. These circumstances, and especially the public health emergency and its economic fallout, are landing hardest on our children, disrupting every facet of their lives. We are seeing rising rates of child hunger and homelessness, expanded learning gaps, and an increase in the number of uninsured children to the highest levels in 2 decades, and we can't even predict the long-term impacts. What we do know is that even before the pandemic, the kids were not all right. The federal government, pre-pandemic, was projected to spend $4.7 trillion in fiscal year 2020. Yet just 7.48% of that goes towards children. 7.48%. And for the record, children make up roughly 1/4 of our population. Today we present the 14th edition of our Children's Budget Book. Our analysis of more than 200 federally supported programs dedicated in part or entirely to children, and our analysis identifies an alarming trend. Children continue to receive a smaller and smaller share of federal spending. Consider this. In fiscal year 2016, the federal government invested a mere 8.19% of total spending on programs and services that benefit children. In FY 2020, that figure dropped to just 7.48, a decline of 9%. On top of that, the president's budget request for fiscal year 2021 would have dropped this share even further to 7.32% by eliminating or consolidating 59 programs that benefit children and making significant cuts to other programs. Fiscal year 2020 was supposed to be a bright spot for children's spending. Congress passed and the president signed the Bipartisan Budget Act of 2019 last year, which raised the statutory caps that are in place to limit discretionary spending, which Congress appropriates annually. In fiscal year 2020, this change in the caps resulted in a $66 billion increase in discretionary spending, but children's programs only received $3.5 billion of it, just $3.5 billion. As a result, the children's share of discretionary spending continued to drop despite overall increases, proving that even when we choose to spend more money, lawmakers don't prioritize children and give them their fair share. While I would add that we welcome the spending increases in the 2-year budget agreement, the caps for the new fiscal year, starting tomorrow, are extremely tight, as the agreement front-loaded the spending increases into fiscal year 2020. As you can imagine, this leaves children's programs competing for sparse funding increases with other important spending priorities. Also, for the second year in a row, we spent more on servicing the national debt than we did on our nation's children. Furthermore, our investment in children overseas is not doing any better. 2020 marks the first time that we at First Focus on Children have analyzed federal spending on children from the International Affairs budget, which spans 7 entities, including the State Department and the United States Agency for International Development, USAID. Our research finds that the dollars dedicated to aiding children globally reflects far less than 1% of our total spending, a dismal 0.11% of the overall federal budget. You can find our detailed analysis of discretionary and mandatory domestic programs and services and the inaugural international spending on children in your Children's Budget Book, which you received this morning in your inbox. Please take a look at our findings and share them with your networks using the hashtag Children's Budget 2020. Tomorrow, October 1st, we begin a new fiscal year. With this new year comes a new opportunity to reverse the disturbing downward trend of spending on our kids. We have invited a bipartisan and outstanding group of members of Congress who are champions and defenders of children to discuss how we can right this wrong. We also will hear from our outstanding advocacy partners and experts in the international children's policy arena. We are so glad that you have joined us, and it is our sincere hope that you will be able to use the information shared today to help amplify the unique needs of all our children and urge our lawmakers to prioritize children in federal budget decisions. For our first speaker, we're thrilled to have this message from a First Focus Campaign for Children, defender of children, Sen Lisa Murkowski of Alaska. Senator Murkowski has been an outspoken advocate, specifically for young people experiencing homelessness. And our analysis shows that there was a 4.9% decrease in the share of federal spending on children's housing from 2016 to 2020.
Hello and welcome to this year's annual Children's Budget Summit. I'm grateful that First Focus on Children is dedicated to ensuring that children are a priority in federal policy. Working with Alaskans and all Americans, First Focus ensures that vital information is delivered to policymakers. The firsthand stories that you provide and the information that you share allow me to do everything that I can to ensure that our children are a priority. Of course, we know that children are some of our nation's most vulnerable citizens, and it's crucial that Congress enact policies that have their best interests at heart. And with the emergence of COVID-19, the lives of families and children across the U.S. have been disrupted. It's everything from school closures and new ways of learning to concerns about consistent meals and a safe home, as well as increasing unemployment rates and the difficulty of finding childcare. We know that times are even tougher than usual, so it is as important as ever for Congress to provide specific assistance to children, youth, and families that are adversely affected by this pandemic. In Alaska, one of my biggest concerns has been for children and youth experiencing homelessness. And unfortunately, the ongoing pandemic has only exacerbated these issues. And that's why I have introduced the Emergency Family Stabilization Act. This is to ensure that the Administration for Children and Families within the U.S. Department of Health and Human Services can receive flexible funding for community-based organizations to help meet the needs of children, youth, and families experiencing homelessness and violence at home. This is just one small piece of the much larger effort to overcome the challenges that our children face. But I think it's a significant piece. As Congress works to provide relief and aid to families and businesses, our first priority should continue to be to actively look out for children who are in need of protection and support. So I'd like to thank everyone who has attended this important summit, and to all of you who are such strong advocates for our children, thank you. Thank you for the good work that you do. Take care.
Thank you, Senator Murkowski, for that compelling message and sharing one of your important solutions to address child homelessness. As the senator alluded to, every facet of the lives of children and families is being disrupted during this historic public health and economic crisis. We know that the needs of families with children are greater than ever now. Perhaps no one knows that better than the frontline workers in our schools. That's why I recently was pleased to sit down with two of the heroes who can tell us what the current situation looks like in the wake of COVID-19 and how federal budget decisions have significant impacts. In fact, our analysis shows that funding for education has fallen by a cumulative 11.4% over the last 5 years. And also these decisions affect their work on the ground and in our schools. Good afternoon. I am pleased to be joined by experts from two of our outstanding partners in the Children's Budget Coalition today. First, I would like to welcome Lori Combe, who is the president of the National Association of School Nurses and is a nationally certified nurse with 44 years of nursing experience, including 27 of those as a school nurse. A guiding value of Lori's work is the pursuit of equity for individual students, as well as underserved populations and communities. I also am pleased to welcome today Kimberly Morrison, who is a Montessori teacher with Detroit Public Schools, currently teaching at Edmondson Elementary in Detroit, my home state, Michigan. And she's been teaching for 24 years, covering different grade levels over her extensive career. So thank you both again for participating in the 2020 Children's Budget Summit. And I look forward to our discussion. During these extraordinarily challenging times, all aspects of our children's lives are being disrupted. And the school year is no exception. Most states are dealing with a wide array of approaches to kicking off the new school year, and children's learning experiences and routines are likely, if not certainly, very different. I will open up with a two-part question for both of you to answer and discuss some of the different challenges in front of us this school year. As a teacher and a school nurse, what would you each identify as the major challenges students faced at school before the coronavirus outbreak, and how are you seeing those challenges change now during this unprecedented pandemic and resulting economic decline? And the second part would be, could you speak to how the public health and economic emergencies are not only exposing, but also compounding the disparities in our society? Kimberly, do you want to lead off?
Yes, I would. First of all, I'd like to say thank you for having me to speak. It's an awesome opportunity to be able to join you this evening. To your first question, I've been teaching for 24 years, and I'm noticing a lot of changes even before COVID existed. Economically, the district that I teach in, of course, we have it's one of the largest districts in Michigan, and children have always had to struggle for what would be a normal thing that you would expect in a classroom or in a school for children. Right now, COVID is compounding some of those issues when it comes to equity. And it's different than equality because we all have school and you have your teachers there, but what we don't have is access to maybe the enough broadband for children to be able to get online during COVID, or where parents are working and have to leave and go to work, children are forced to have to be in classrooms that may not be as safe for them to be in. So that's one of the challenges that I see that have changed over time. And especially now, COVID is starting to bring that out even more. Yes, that's kind of it for me. I'm seeing a lot of issues where parents are not able to stay at home with a child or have the care that they need at home. So they're forced to go into buildings that may not be absolutely safe for them to be in. And all of that's based on economics. So.
All right, thank you for that. Lori, do you have some comments?
Yes. So the data that you'll see on your screen soon is a pre-COVID glimpse of challenges facing children's that impact their health and their learning. What we know is that during COVID-19, food insecurity has grown from 11 million to 8 million children, that for parents who do not speak English, there are already existing barriers in access to education and healthcare are compounded because they're being asked to support virtual learning. Maybe they don't have broadband access, they don't comprehend the instructions, and we're asking them to follow the ever-changing and somewhat confusing COVID healthcare guidelines. For those children, and Kimberly, I think you've already referred to this, particularly children in single-family homes, those parents are facing difficult choice: keep my job or supervise my children, which is the better choice for my family. We know that parents without a high school diploma are more likely to have lower wage jobs, which is either putting them at risk for COVID exposure or again for job loss. access to healthcare has been a concern for school nurses for many years. And this fear of COVID-19 has caused parents to avoid going to their healthcare provider for either chronic illness checkups for their children or well visits. And we know that there is an increase, as I mentioned, uninsured population. So that is creating a barrier to healthcare. And then finally, if we look at homeless, in 2019, 560,000 individuals in the US were homeless. That includes children and families. And we know despite protections that have been afforded during this pandemic, families are being evicted and they are couch surfing on family and neighbors' sofas. So these factors really serving to destabilize student health and learning.
Thank you both for your comments on that. Just a little bit of a follow-up there, because you mentioned a number of different issues, but one thing that came through from both of you was the technical aspects and the need for families and the children to have access to broadband and the devices to participate well in online learning. So have you, in your experience, seen some creative solutions to that problem? I know here at the federal level, that's something that we're concerned about and advocating to see in another COVID relief package, more support for access to broadband. I just appreciate a follow-up thought from either of you or both of you on that.
Okay. All right. So we work in our district, and I can only speak to that. Creatively, they have invoked the cable companies to allow parents who may not be able to afford the cable for only a certain amount of time. So once that time wears out, we don't know, if that's going to be reestablished for the parents. They also have had business partnerships with different companies that provided tablets for the children. However, as we're now, I think, 11, 12 days into our school year, some of the tablets are not working properly. There's a lot of technical issues with the tablet itself. And so, children are unable to have a consistent learning day or learning period with some of the issues that they're having technologically.
I would say in my experience, there was this disparity existed prior to COVID-19. Students who were supposed to communicate with their teachers virtually about assignments or to submit assignments were having to travel to coffee shops or whatever to submit that work. So amplified now if all your learning is here. So school districts have been pushing out Wi-Fi beyond the school walls, which means students are having to come to parking lots. That was an early solution. Now, local school districts here in my area of Texas may be providing hotspots that those students can take into their homes. That's a substantial financial outlay.
Yeah. Thank you both for your thoughtful comments. And clearly, we have a lot to do to ensure all our children can learn in a safe environment and succeed. And you were both right on topic, given that this is a budget summit and that additional resources are needed. And I appreciate the comments, Kimberly, from you about the creative nature that some of the school districts are implementing. But there certainly is a need for more federal resources in that direction.
Absolutely.
So, Lori, even though it appears that children are at lower risk for contracting COVID-19 compared to adults, they aren't immune, and we don't know all the long-term effects at this point. In addition, pediatricians have repeatedly noted that child abuse is more severe, more fatal, and more prevalent during the pandemic. As a school nurse, you play an important role I love my school nurse, in supporting student health and success? What additional federal resources are critical to ensure that our children stay healthy and can learn in a safe environment and ultimately thrive and achieve their potential?
With 4 million individuals added to the Medicaid rolls, federal support for Medicaid expansion is absolutely essential for families. In addition to that, NASN and its partners are asking Congress for $208 billion to support the personnel, material, and facility improvement needs of schools. Here in Texas, the Texas Education Agency used CARES Act funding to supplant their funding to schools, not to supplement it. So how would schools use that funding? Well, school nurses and other specialized instructional support personnel always work to support student health. An example is that for the 16% of students who access mental health services, 70% of them access those services at school. And the predictions are proving to be true. School nurses are already identifying increased mental health needs as students return to school. And we know if we don't meet those needs, students won't learn. Healthcare happens at schools, and as such, the providers of that healthcare need access to appropriate personal protective equipment. N95 masks, gowns, gloves, you name it, they need it. We also need increased access to the volume of disinfectants that we're using on campuses to keep surfaces safe, both high touch and healthcare services. And then we need facilities improvements. Many schools in this nation have poorly performing HVAC systems. They have mold problems. We need additional hand washing facilities and more.
All right, thank you for that. And yes, we do have our work cut out for us. So thank you for sharing all of that. Kimberly.
Yes.
As we see states and districts across the country go back to school using a variety of in-class, remote learning, and blended or hybrid approaches to teaching this school year, what changes, both good and bad, are you seeing inside and outside the classroom that could instruct how we should consider reforming the way our education system works so all kids from diverse backgrounds and abilities can thrive? And additionally, what federal resources are needed to achieve that goal, in your opinion?
All right. So the first thing that comes to mind is when we were under emergency managers, for sure, we were under scrutiny for our funds, and it wasn't enough funds. Then teachers had to lose pay. So now that we fast forward to a COVID situation, coming out of an emergency manager and then now into our superintendents and our school boards, we're finding it crucial that funding is provided for not only enough teachers to be able to provide the distance learning that needs to happen when school opens fully for everyone. Also with the PPE, there's issues even now with PPE, even though there's been funds, appropriated for that. Also, it's so politicized. Everything is based on whoever the local or the state level government, whoever's in charge of that government, the political party. It really seems that we're not getting the funding based on that, or there's always a conversation around whether or not the governors or the local people are doing what they're supposed to be doing with the funding. So right now, the good and the bad is that we do have an opportunity during this election, I think, to turn some things around, and hopefully the funding will be available that's needed to balance out some of these inequities that we see. Some of the things that Lori mentioned, she said the school building is not having the HVAC systems in, and the windows sometimes don't open. And this is a big issue in our district. One of the poorer districts, because of the tax base that exists in Detroit, is coming around now. I'm at a Montessori school where parents really select that educational process. So we have working parents there, 2-family home. so it's not as bad, but the school system and the infrastructures are still in need of a lot of support and a lot of funding. Teacher salaries need to be resumed and put back to where they were to keep up with inflation. And all of that is based on funding. Our tax base won't cover it. We have school districts right around Detroit, Bloomfield Hill, and we're often told by our higher ups that, we're not Bloomfield Hills. Well, that shouldn't even be a part of our conversation. We should all be the Bloomfield Hills or any other district that allows children to be educated in a proper way. Without some of the deplorable situations that we deal with on a regular basis.
Great. Thank you both for that. I know our time was short today, and I thank you so much for participating in Children's Budget Summit this year, and particularly spotlighting some of the critical issues that have been around for a while, but are certainly being exacerbated during this pandemic and economic downturn. And it is at a critical time. The election's around the corner. Congress will be making some critical funding decisions here. I know we have a continuing resolution that's about to make its way to the president ideally, but more decisions down the road, certainly for COVID relief and recovery. So I really do appreciate your comments. I think it adds a lot of value to our summit. And if either of you have a closing remark, I welcome that. Otherwise, I will say thank you again and we'll sign off.
Well, I do have a closing remark. I would like to urge Congress and the public to recognize that schools are tasked not only with providing education, but also with meeting the social and health needs of the students in those classrooms. And those needs need to be met first before students can engage in learning. And so I urge Congress to understand that and to adequately fund the future of this nation, our children.
Thank you for that.
I would like to also add that I do believe that we should do right by children. Being what I call myself a frontline worker on the line with children in those classrooms, the federal government has to be committed to robustly funding schools. It is not a choice. It is absolutely necessary. Children first. That's what we always say. Children first. So if we didn't have so many haves and have-nots in our educational system, then we could probably handle the challenges a little better. But as it stands now, the way that the things are happening in the country, we have to come together, and we have to come together for the children because they are the future.
Both of you, well said. Thank you so much. I look forward to continuing our work together. Please be safe and take good care.
Thank you.
Thank you, Michelle.
Bye.
Bye, Kimberly.
Yes, bye.
Bye-bye. As you just heard, schools are so much more than just a building where kids go to learn. Our next speaker understands this in a way that many of our elected officials don't. As ranking member of both the Senate Health, Education, Labor, Pensions Committee and the Labor HHS Education Appropriations Subcommittee, Senator Patty Murray has been a fearless champion of children. We're proud to welcome her to the Budget Summit, where she will share some of her legislative solutions to help address the needs of the youngest among us.
Hello, I'm Senator Patty Murray, and I'm thrilled to be joining First Focus today for the annual Children's Budget Summit. This year has been difficult for everyone. Between abrupt school closures in the spring and remote learning continuing this fall, growing barriers to accessing affordable quality childcare, and the lack of federal paid leave and family leave programs, it's so clear that families with children are facing impossible decisions and incredible uncertainty. They need federal support. My Democratic colleagues and I have solutions that would give child care providers the funding they need to stay open and make sure working families can afford child care. Make massive federal investments in K-12 schools to help ensure that all of our kids get a quality education, whether it's in person or remote or hybrid. And make sure parents don't miss a paycheck when they need to stay home sick or care for a sick loved one. Unfortunately, Senate Republicans have spent months wishing the virus would go away on its own. delaying response efforts, putting forth piecemeal, unserious proposals, and fighting among themselves, leaving parents and students and teachers without adequate resources or support. But despite their inaction, I am fighting tooth and nail in the next relief bill, the next spending deal, and beyond, to make sure that children and families don't bear the worst of this pandemic's consequences. So thank you again for convening this important event and highlighting the critical work to make sure the federal government is prioritizing children and families today and into the future. Know you will always have a partner with me. Thank you.
Thank you, Senator Murray, for your remarks and tireless leadership on children's issues. For our next conversation, we wanted to dive deeper into the debate around childcare, which has become more important than ever before during the coronavirus and economic emergencies. To help us understand, our own resident expert, Avery Pakulis, First Focus Vice President for Early Childhood and Public Health Policy, sat down with Tom Wyatt, the CEO of KinderCare Learning Centers.
Okay, good afternoon. I am thrilled today to have with us Tom Wyatt, who is Chief Executive Officer of KinderCare Education. KinderCare provides early childhood education and school-age programs for more than 185,000 children across the country in over 2,300 locations. As we all know, child care providers have been on the front lines of the COVID-19 crisis, and many of them have stayed open to care for other essential workers' children. Others have unfortunately closed, some permanently, some have an unclear future. And as an organization, First Focus on Children knows how vital childcare is in this country. The COVID-19 crisis has made that even more apparent. The childcare sector, however, was in a precarious position prior to the pandemic as well. And we want to start there in our conversation with Tom. So Tom, again, welcome and thank you. And my first question for you is, as CEO of one of the largest childcare providers in the country, what are some of the biggest challenges you were already facing prior to the COVID-19 pandemic?
Happy to take that, Avery, and it's a pleasure to be here. We really have two large challenges that have faced us, quite frankly, for the total time of our existence. First is really affordability and access. The second one is talent access and workforce issues. Let me take affordability and access first. As you know, childcare is an essential workforce support group. Without us, families can't go back to work, and it will slow down the economy. Yet Americans really do lack access to high quality, affordable care for a number of reasons, cost being the largest one, but also there are areas of the country that don't have a number of, if you will, footprint large enough to really take care of the demand in those areas. And all of that's been made worse through the pandemic. The cost of providing child care is a very expensive ordeal. The labor involved in this, because of the ratios that we do in our classrooms, the actual work that we do with children, literally the length of time that we have children in our centers, which can be 10 to 12 hours a day, really puts a burden on the cost of labor in our model. The pandemic has really put providers in a very precarious financial position because, quite frankly, now we're having to add more labor for health and safety purposes, for the lower ratios that we're working in today because of state mandates that we're going through. So there's really been a very challenging time for us, literally since March of this year. And even as we started to open centers in June and July, there are predictions out there today that say that we'll lose 20 to 50% of our capacity or our centers during this pandemic. And quite frankly, we've already witnessed a number of centers that have closed and candidly will not reopen. Public funding for this industry is critical to close the gap for these issues, if you will, what families can afford and what and the opportunity and the, if you will, the spectrum of how many high quality care units are out there, centers are out there. It's more important than ever for lawmakers to consider a few things, and we've discussed this with many folks in the Senate and in the House. First being a short-term, if you will, stabilization fund for childcare. We believe it should be grants, and it's a fund to help us deal with the impact of the pandemic, the cost of labor, the cost of actually shutting down our centers, which I'll talk about in a minute, but also PPE, all the things that have really been an increased cost to us. We need help to get back on our feet. From a mid to long-term standpoint, increasing child care credits for the middle-class families, the ones that we call private pay, those families really do need help. Many of them lost their job during the pandemic. Many of them took salary reductions and candidly are struggling financially to get back to normalcy. We also, in fact, in KinderCare, I'll share with you that about a third of our families are actually benefiting from the Child Care Development Block Grant, CCDBG for short, which is a block grant that has been around for many, many years that supports low-income families. So about a third of our families, the children in our centers, are from that area. Long-term, from an infrastructure standpoint, we believe we need to create infrastructure grants and partner with the private sector to build supply in the child care deserts. I live in Oregon, and I will tell you, I talk to Senator Ron Wyden all the time about the work that we need to do in the rural parts of Oregon where there is literally no sites for these children to take advantage of, certainly no high-quality sites. So those are really the key things there. From a workforce issue standpoint, attracting and retaining teachers today is critical, and it's a very difficult task for us. And we really believe there are a few things that we can do to make that easier for us and, quite frankly, more rewarding for the educator. One is to create a standard credentialing, if you will, to recognize across our states and the federal government, federal funding streams, and to incentivize providers to actually subsidize that. We have an opportunity to do that for all of our teachers, which will also raise the credibility and, if you will, the standards in the classroom. We also think that apprenticeships, where we could take our educators and they could actually be incentivized to participate in an apprenticeship program. Providers would receive tax credits maybe or grants to offset the expenses of that, but that too could help us create a higher quality experience for families. And then the last one is tax credits. If we could create a national refundable tax credit for early childhood educators working in this environment, licensed high quality centers, makes a lot of sense to us, and we think that would help us incent people to get into this industry. Bottom line, the nation is facing an ever-growing child care crisis, and it's something that we need to address, and it was exacerbated by the pandemic. So we're looking forward to hopefully seeing lawmakers help us address these things with the funding they have.
Thanks, Tom. That's a lot. During the pandemic, I think, as I said in the opening, we know childcare is absolutely essential to our economy. And one of the few benefits that I think possibly could be happening is that is becoming a realization more and more people are understanding. Do you feel like certainly in the pandemic, but in the last few years, do you feel a shift in the appreciation for childcare and the recognition that it's absolutely vital to our economy for a number of reasons? Do you see sort of a wave changing here?
Yes, we do. One of the heartfelt things that we got out of the pandemic is, quite frankly, both the realization of from Congress as well as parents how incredibly important we were to the infrastructure of that family unit. Families have gone through a lot. Children have gone through a lot over the last 7 months, and we have seen an incredible respect come from this. Give you an example, KinderCare, we'll talk about this more in a little bit, but we closed the vast majority of our centers back in March because nobody was coming to those centers. But we left a number of them open, which we'll get into in a minute. But we did that for essential workers. And the amount of dialogue, the amount of appreciation, the number of emails, phone calls that I received thanking me, because we had We had doctors, we had nurses, we had supply chain specialists. We had a number of people that were keeping all of us alive and functioning, that without childcare, they didn't have an option. They don't live close to their parents. They don't have other people in the community that can take care of their children, and they have to go to work. And their work is not working from home. So yes, we felt a incredible amount of appreciation for the services we provide, and the high quality that not only do we actually help the child in a nurturing environment, a normalcy environment, but we're also educating the children. So it's a very important part of the development of a child.
Yeah. I think that I'm glad to hear that. I think that sort of appreciation and realization is helpful on the ground, and then that also trickles us up or down to Congress and lawmakers, and that can help a lot. Are there any, we've you mentioned that centers have closed and have had to take on new challenges and costs. Are there any other burdens or challenges that centers have felt? We've heard, of course, we talked about some have closed, some we understand have taken on debt. They've had to reduce enrollment. Are there any other sort of on the ground specific challenges they've had to face?
Yes, and let me just sort of tell you the KinderCare story since March. Adrian, I promise I won't take you too far deep into it. But back in March, we were serving 185,000 children in our centers. Actually, 187,000 children at that point. It was a peak of number of children we've ever had in our centers over the 50-year life of our company. And the following Friday, March 13th, 187,000. March 20th, we had 13,000 children in our centers. So it was it decimated our centers, quite frankly, and obviously impacted our business critically. And we decided during that week, as we saw this happen, that we had to do a couple of things. One, we had to furlough a number of employees, which was very difficult, but necessary to survive. We also had to take into account, we wanted to take into account, candidly, how do we serve these essential workers that we were hearing so much about, particularly in the medical field, but also supply chain, grocery store, industry, what have you. And we needed to be sure that we were there for them because it's our mission. We support families. So we went through all that, and throughout that time, we kept, of our 1,500 total centers, 2,200 in total, including our before and after school program. But of all of our centers, we left 400 open during that time, all 400 losing money. But we felt like it was the right thing to do. So we went through that. We bought the PPE. We did the things that we needed to do around training of new safety and health protocols. We worked closely with the CDC. That was an investment for us. So all of these things were adding up at a time when our revenue was down 90%. So we went through that time. It was an important time for us. Since June, we've opened every single one of our centers. We are, at this point, open and operating every single one of them. And some are operating at a break even, but many are still operating at a loss even today because of the standards that were set by the states that we're operating in. So from a standpoint of what we feel like needs to be done from the financial support point of view and what can help with parents, there are things that we want to prioritize and talk about. One is increase in the child and development care tax credit. That tax credit helps the, if you will, middle income families afford the cost of child care. So we think that would be a very important part of what we've already talked to Congress about. Also, the creation of a young child tax credit would help young families afford the cost of high quality child care. It's important because this is a significant, many families, lower middle income families who are burdened by paying all of the tuition. Quite frankly, this is larger than their house note. This is the most expensive cost that they incur on a monthly basis. So anything that we can do to help them would be incredible. We also believe that employers, and many do, by the way, employers should be incentivized to subsidize the cost of care. We have a number of employers that we work with, that we have centers on site of their corporate offices we have other widely dispersed employers that also incentivize, quite frankly, their employees to take advantage of childcare and create and subsidize it to a degree, which we think is a great way to put it into the benefits package that, you know, the young generation, particularly millennials and Zers who are now obviously coming into the marketplace and really do want a more holistic view of the benefits that companies offer them, and childcare is one of them. So we believe all of that should be a part of what we do. We're convinced that increasing tax support is a good economic investment. We believe it'll pay dividends. Childcare is a holistic part of these families' overall lifestyles, and we'd like to see that. In addition to the tax supports for the middle-class families, we talked earlier. I will tell you that the CCDBG grant, Child Care Development Block Grant, is key for these lower-income families, and candidly, only represents about 5% of the industry, and quite frankly is falling woefully short of all the families in the lower income sector that would like to take advantage of CCDBG. So I'd say to you that that would be an opportunity for us to go even farther into what we believe is important. So I hope that answers your question.
Absolutely. And, you know, I think I'm also struck as we're having the back to school debate and kids are heading back to school in various formats, that childcare is even more in demand now, if that was even possible. Are you seeing that on the ground? Is that true? Are there, you know, are parents leaning on you more heavily now that they've got these possibly hybrid or all remote options that they're dealing with for their school-aged kids?
You know, the ones that have come back certainly are very dependent on our schools. They're working, they're working from home and need their child to be in a place where they can be socially and academically developed, and at the same time they can be at home and be productive. So yes, the families that have come back are certainly very dependent on our services. That being said, there's a number of families, as I mentioned earlier, that are financially impacted that simply can't afford to come back at this point. There are other families that are just reluctant. Maybe they have a family member that has a pre-existing condition and they're concerned about the exposure that may be in a child care center. So even though the health and safety protocols in our centers are world-class, and they are clearly the number of cases that we have in our centers is a fraction of what happens in the states that we serve. So we've proven that our centers are a sanctuary for the kids, but there are still families that are reluctant. I think candidly, it's like flying, right? People are concerned about getting on an airplane at this point. The same is true about some families coming back to the center. So we're still struggling with occupancy at a time when our costs have gone up.
That unfortunately makes a lot of sense. Thank you so much, Tom. You've touched on a lot of really daunting challenges that your industry is facing right now, and also brought up some really important policy, both short and long-term policy changes that are needed, and that we look forward to First Focus on Children to working on as well. You know, as we've talked about, childcare holds up our economy, and as that understanding continues to spread, we look forward to working on those changes that are needed to strengthen childcare and treat it like the public good that we all know it is. So thank you so much for your time today. I really enjoyed our conversation.
Thanks, Avery. It was a pleasure.
Thank you, Avery and Tom. As you just heard, our current situation exposes the sad fact that children are an afterthought in our society, and that even before the pandemic, their needs were overlooked and underfunded. Our next speaker, however, has been a steadfast advocate for children in the United States Senate, who has consistently worked to make children a priority in his work across a broad landscape of issues. Senator Sherrod Brown of Ohio, as you'll hear in a moment, wants to focus on solutions to improve children's health, the child welfare system, and address some of the harsh realities that we just heard from Avery and Tom.
I'm Senator Sherrod Brown. It's an honor to serve you in the United States Senate. Thank you to Bruce and Michelle for inviting me to speak to the Children's Budget Summit. Thank you to First Focus for the important work you do every day to make sure Congress puts a priority on children and on families. From fighting to extend CHIP to supporting improvements in our child welfare system, your advocacy has been critical on so many issues. Thank you for that. It's great to see that even in these difficult times, First Focus is able to have this year's summit virtually. Even before this pandemic, we knew that our child care system was broken and our government wasn't doing nearly enough to invest in our children. More and more families don't make enough to afford the increasing cost of child care. Now with COVID-19, families across the nation are facing record unemployment, as we know, struggling to make ends meet, even facing eviction, putting a massive strain on children, yet the Senate just says essentially you're on your own. For far too many, people are trying to manage all this without adequate child care or paid sick leave. Congress needs to get a relief package passed that helps struggling children and families. We also can't go back just to business as usual, as if things were that great before the pandemic. It wasn't working for a whole lot of people. We need to take a much deeper, broader look at how federal policy, the impact it has on children, and bring in children's voices and experience into a policymaking process. That's why I'm proud to have consistently supported First Focus's legislative priorities, expanding the earned income tax credit and the child tax credit to cut taxes for working families. It includes a fully refundable child tax credit so that kids and families who need the most help can get it. It's the most important single thing we can do to fight poverty in this country. We should provide flexible emergency funding for child welfare programs so they can navigate the pandemic. We should work to prevent child abuse and neglect. We know that domestic violence and child abuse have become even more of a problem during the pandemic. We must support paid sick leave, and we should support a $50 billion child care bailout in the next coronavirus package. Investing in kids means investing in families, investing in young people. As long as I'm in Congress, I'll keep fighting to ensure the federal government, actually Mitch McConnell and the federal government actually do our jobs, prioritizing children, pushing back against cuts of investment in children domestically and internationally. Thank you, all of you, for fighting for our children. Dr. King, one of my favorite quotes in the letter from the Birmingham jail, he said, progress never rolls in on the wheels of inevitability. And you and this organization understand that as well as anyone, that the change we want, we have to make, and you've stepped up and done it. So thank you so much for your activism.
Thank you, Senator Brown. As you just heard, the range of issues that we need to focus on to improve the lives of children is certainly extensive. That is true both here at home and abroad. The truth is we don't spend nearly enough. As I mentioned earlier, for the first time, this year's children's budget book includes an analysis of how the federal budget impacts children around the globe. We estimate that we spend just 0.11% of the overall federal budget on children internationally, less than 1/10 of our overall foreign assistance budget. To help us understand what this all means, Kathy Sacco, First Focus Vice President of International Children's Policy, will speak to two experts in this field about these numbers and some possible solutions moving forward.
To discuss the importance of investments in children globally, we are honored to speak with our guests today. We have Ambassador Susan Jacobs. Ambassador Jacobs was a career Foreign Service officer for 40 years. She served as the State Department's first special advisor for children's issues from 2010 until her retirement in 2017. And for full disclosure, Ambassador Jacobs was my boss when I worked at the State Department. We also have Roxanne Pasible from Interaction. She is the Senior Manager of the Children and Youth Initiative. Roxanne is an experienced global development advocacy expert with experience at the African Development Bank Group, PATH, Oxfam, and International Rescue Committee. So I just want to thank both of you for joining First Focus today.
Pleasure to be here.
Thanks.
Great to be here. Thanks, Kathy.
So I guess let's just jump right into it. And so I would like to start with Ambassador Jacobs. Ambassador Jacobs, in your experience as the first special advisor for children's issues at the State Department, what did you identify as the major challenges and problems children around the globe faced?
Kathy, first I want to thank you very much for inviting me to participate in this, and it's as well organized as everything that you did when we worked together. So thank you very much. and that is the truth. So what I think, though, is that the problems for children are really problems for families. I think that the focus really needs to be on families so that they can provide healthcare, education, clean water, and a safe living environment for their children. And if we can do that and focus our attention on the families, then I think that we go a long way to solving a lot of the problems that children face.
Great, thank you. How do you think these challenges have changed or not since you retired?
I don't think the problems have changed, and I don't think that some of the solutions that you and I put forward have been adopted yet. One of the things that we tried to do in the interagency process was to have all of the programs that relate to children work in a connected, coordinated manner. And that's why I think putting together this budget book is so important, because you have teased out all the programs that affect children. And if we could get the donors to work with the recipients in a coordinated way and to ask them what they really need and how do we go about providing it, I think we would be in far better shape. And in so many meetings, at least in the interagency process in the United States, no one is willing to accept that maybe what they're doing isn't exactly what's needed, or that others might be able to help them do it. And they're afraid to go back to the Hill from whence all money comes and say, this isn't working, we need to try something else. So I think that if we could finally do that and then work with all the NGOs and the IOs to really do programs that are going to help families and therefore the children, that we could accomplish a lot more than we've been able to.
Great. And I think, I would add, I think it's looking at, it seemed like you were talking about wanting to try to look at these issues for children and families in a holistic perspective, where everything sometimes is siloed within the community. So what are some steps as a follow-on kind of, I think, to what you were saying, you were alluding to the interagency process that you worked on and things, but what are some steps maybe the United States government could do to better help children globally?
Well, I think what they need to do is to figure out with the country that the children are living in, what do they need? What do they really want? And how can we, working together with other donors and with NGOs in the United States, provide what they need? And everybody is afraid to start over. And sometimes I think that you have to start over, because I think that what we're doing is kind of broken. We spend, it's not a huge amount of money, but I think that we need to do it in a more holistic way. I don't think there should be 3 programs in 3 different agencies that work on child labor. There has to be a way for these entities to first work together in the United States and then to work cooperatively with the host governments. And they definitely need to have a bigger say in how this is run. We can't just go in and say, this is what we think you should do, and here's the money, and if you don't do what we want, then you can't have the money. So we need to get everybody working together. And Kathy knows that I made this pitch many, many times, and it was never accepted. And so I just, there's a whole new crew at AID that works on this issue, but it's the same problems.
Great.
So I think that we need to do a better job. And I also think that we need to be able to show the results of what we're doing. There have to be real measurements in place. We have to show, yes, we have vaccinated, 200 or 500 or 2,000 children against all kinds of childhood diseases, and this is how we've done it. But we've also trained people in the country to do that work. I mean, it can't be us. You have to have buy-in from everyone involved.
Great.
So that's what I think.
Thanks so much, Ambassador, because I know you have a wealth of experience, and having worked with you, that you travel to over 40 countries and looking at these issues. So I appreciate you sharing your experience and thoughts. So I would like to just turn it over to Roxanne, and with all your experience, Roxanne, too, that you bring to Interaction. I know Interaction has a new child and youth initiative. So what do you hope the initiative will accomplish for children and youth around the world?
Yes, well, first off, thank you, Kathy, for inviting Interaction to this virtual table. Interaction is the largest alliance of international NGOs here in the US, and our 180 members run life-saving humanitarian as well as development programs in more than 100 countries. And our members have been working on these issues for decades, and this effort really builds on the existing policy and advocacy efforts of Interaction members. And we're excited to work collectively with our members to advance the well-being of children and youth. And we're also grateful for the multi-year funding pooled through the Tides Foundation, which makes this work possible. And so for this initiative, we hope to provide young people with hope and the opportunity to thrive and succeed. And we aim to achieve this overarching goal in 3 ways. First, our efforts will focus on urging the US government to adopt better funding and better policies to ensure that the most marginalized, including girls, children uprooted by conflict, young people with disabilities, are not left behind. And with effective policies and robust investments in place, we hope to ensure that children and youth are equipped with the right skills, the right resources, and the right tools to reach their full potential. And with increased investments and resources, we all know that it's really important to support thriving economies and robust democracies. And that's, all part of an empowered, healthy, and educated population. And so ultimately, this initiative is really about supporting young people in becoming productive and contributing members of their communities. And second, this initiative takes a whole child approach to addressing the diverse needs of children and youth. And sectoral issues like education, gender equity, nutrition, health, violence prevention are all interconnected. And children and youth do not live in sector silos. So it's important for Interaction's Children and Youth Initiative to have a cross-sectoral advocacy approach. And third, young people are change makers in their communities. And young women and young men are already speaking up and speaking out and really putting their dreams and aspirations for a more inclusive and brighter future into action. And through this effort, we'll be working with our members to connect young activists, young advocates with opportunities to share their experiences and skills. And lastly, I just wanted to mention that, again, this effort is really about amplifying and elevating the work of our members. And it's really about creating a platform to really advance efforts around funding and policies to support children and youth globally.
Great. Thanks so much, Roxanne. And I think it was interesting that you brought up about things about funding, for instance, because that is really what we are doing in the children's budget book, right? Is to look at where are the funding streams coming from, how much, and things. And I know that there wasn't a lot in the area of children and youth. So I know in my experience, just having done this for the first time this year for our budget book, but then also you alluded to that too, and the need for federal resources. But do you have ideas for greater transparency in the delivery of federal resources for international programs and initiatives that benefit children?
Yeah, this is a great question. And, I should add that, the main impetus for this initiative comes from the Elevate Children Funders Group report. And the report talks about, this very question about the need for enhanced coordination and transparency. So they put forward two solutions, which I think are quite important for us to think about in this context. One is around putting forward a centralized mechanism to, track and monitor U.S. government assistance for children and youth programs across sectors and across agencies. And we know that children and youth don't live in silos, but the funding does. And, there's no easy way to track funding across various accounts and agencies. And so I think increased transparency will help to elevate children and youth issues in policy decisions. And then secondly, children and youth programs are multi-sectoral. And as Ambassador Jacobs mentioned, it involves multiple U.S. government agencies. So I think a strong U.S. government coordination structure on global children and youth issues could help to harmonize implementation efforts, also help to track programmatic metrics across agencies. And, I know this is not easy to achieve, and it's not clear, how this structure could work, but I do believe that, it's so important to really prioritize coordination and transparency to achieve better outcomes for children and youth.
Sure. Thanks, Roxanne. And I would like to address this really to both Ambassador Jacobs and to Roxanne, this question, because I think this is the whole point of our children's budget book, right? Is to look at exactly what are the funding streams, how much is going in, and we really saw here that very little federal funding goes to children internationally. So I would just like to ask for both of your thoughts as what would an increase in federal resources mean for children globally?
Well, you could do a lot more. and I think that would be great. And I liked what Roxanne was saying. And I think it is important to break down those silos and find out how agencies can work better together to make the money go further. I mean, there are too many programs trying to do the same things. And I think that if we could talk more directly to the Congress about some of these programs, why they're important, and the impact that they will have on children's lives, maybe they would have a better understanding. And I think that would be a start. And I think that's why the budget book is important, because it's got every program in it. And you can figure out which programs go together and which ones don't. And then go back to the Congress and say, you're giving us X dollars to do this. What if you gave us X dollars and we do this, this, and this, but we do it in a coordinated way? And we do it with interaction, and we do it with all these agencies, and we do it with the host governments, and then we could have a real program. So it would be great to have more money, but I think we could make the money that we have work more effectively if we were more coordinated in going to the Congress.
Well, absolutely. I also think that increased resources would mean that children and youth are no longer on the sidelines, and that they're at the center of U.S. foreign assistance. I also think that, increased resources would really help young people to apply their skills and talents to support inclusive economic and social development in their own country. And I think investing in young people would help to advance U.S. foreign assistance objectives. And also, I think investments in strong public-private partnerships are important to accelerating progress on children and youth issues globally. But also, I think resources alone are not enough. I think effective policies are important in terms of addressing the root causes of inequalities that young people have confronted for far too long. These are the issues that we'll be addressing through Interaction's Children and Youth Initiative. And I'm excited about the strong bipartisan support that exists for the children and youth issues, and really looking forward to leveraging the many advocacy opportunities to sustain the momentum on children and youth issues globally.
Great. Well, I want to thank both of you so much for sharing your thoughts and wisdom. And I know First Focus, we're looking forward to working together with Interaction too on these issues. And I also want to thank Ambassador Jacobs too, always, for sharing your thoughts.
Thank you. It was great to meet you, Roxanne. Wonderful to see you, Kathy. Thank you very much.
Thanks.
Likewise, great to meet you, Ambassador Jacobs and Kathy. Really looking forward to working more closely with you as we accelerate progress on these issues.
Absolutely.
Great.
Thank you.
Thank you, Kathy, Roxanne, and Ambassador Jacobs, for your very thought-provoking discussion. While tax code provisions are not included in the Children's Budget 2020, we need to recognize that all of our budget-related decisions impact children. And when we prioritize children, we all succeed. Our next speaker, Senator Michael Bennet of Colorado, has made this point clear in the policies he champions. He is the co-sponsor, along with earlier guests, Senator Sherrod Brown, of the American Family Act, which would expand and strengthen the child tax credit, converting it to a child allowance program, and will cut child poverty by an estimated 40% in a single year if enacted. And as this year's children's budget book points out, child poverty costs the economy up to $1 trillion a year. I'll let Senator Bennet explain more.
Hi, everyone. I'm Michael Bennet. Thank you to First Focus on Children and to your President, Bruce Leslie, for inviting me to speak with you today. And thank you for all the work you've done to produce the children's budget. I've read the budget in past years and look forward to going through it again this year. I don't have to tell any of you how massively we've underinvested in America's kids. This is especially true for kids living in high poverty communities. Our lack of investment in education, healthcare, climate, and infrastructure denies millions the chance to live up to their full potential and makes our deep racial and economic disparities that much worse. Before I was a senator, I served as superintendent of Denver Public Schools, a district with a majority of kids of color and kids living in poverty. I saw up close every day the economic hardship too many children face. The students I worked for would show up to school eager to learn, but too often they didn't have a safe place to sleep at night or enough food to eat in the morning. And their parents bore the immense burden of trying to make ends meet without a living wage. Fortunately, we know there are solutions that could make a dramatic difference for our kids. One of those is the American Family Act, my bill with Senator Sherrod Brown to expand the child tax credit. It would cut child poverty by more than 40% in a single year, and it would cut poverty for Black children by more than 50%. Because of the work many of you are doing, we have built a huge amount of momentum around this bill, with 38 co-sponsors in the Senate and 186 in the House. Right now, we have a chance to set a marker for the American Family Act by including elements of it in the next COVID relief package, and we have a real opportunity to pass the full bill into law next year. So I'm deeply grateful for what you've done so far to get us here, and I look forward to working together to push this over the finish line. America's kids deserve nothing less.
Thank you, Senator Bennet, for your incredible leadership on the American Family Act and your appreciation of our children's budget book. For our final segment, we are proud to welcome First Focus President Bruce Leslie, who had a chance to sit down with Representative Ben Ray Lujan of New Mexico. As you will see, Bruce and Congressman Lujan cover a number of policy areas where we need to elevate children's unique needs, starting with our finding that the overall share of federal resources for children has declined to just 7.48%, a trend we must turn around. Bruce, take it away.
Right now, it's my pleasure to be joined by First Focus Champion for Children and Congressman representing the 3rd District of New Mexico, Congressman Ben Ray Lujan. I've been a big fan of the Congressman for many years. When I was working in the New Mexico delegation, did a lot of work with him when I was working for Senator Bingaman, Jeff Bingaman from New Mexico. And just so you know, the Congressman has always been a huge champion for kids. Throughout my time there, we worked together in a lot of different ways when I was on the Hill, but since my time at First Focus, we've also done so much work with the Congressman. I will make one point, which is during the Children's Health Insurance Program reauthorization, this last time, there was one amendment that was passed into law, and that was amended by the Congressman. And he offered an amendment to really improve outreach and enrollment of kids in the Children's Health Insurance Program, which has been a huge, important issue for kids in New Mexico. So anyway, with that being said, really pleased to welcome Congressman Lujan. Thank you.
Well, it's an honor to be with everyone, and thanks for having me today. As was said, I'm Congressman Ben Ray Lujan, serving in the U.S. House of Representatives and also serving as the Assistant Speaker in this Congress as a member of the leadership team. And I'm very proud to represent New Mexico and especially the children that we need to be advocating for, and families across every corner of our beautiful state and across the country. So thanks again for inviting me to share a few words with you at this virtual Children's Budget Summit. While we can't be together in person, I know that all of you are still hard at work fighting for the investment for our nation's children. This past year, alongside many of you, I was honored to be named a champion for children for my work fighting to ensure that the federal government responsibly funds programs that benefit our kids. During the COVID-19 pandemic and the economic crisis that our nation is sadly facing, investments in our children could not be more important. These overlapping crises are hurting our children, and Congress must protect and invest in Americans at the most vulnerable and important developmental stage of their lives. To better support our children, students, and working families, I'm working to tackle food insecurity, bridge the digital divide, and bolster childcare. Our children are our future, and it's time that our federal government recognizes that by making meaningful investments. Last year, I was proud to co-sponsor the Child Care for Working Families Act to ensure quality, affordable childcare is available to every family. And just a few months ago, the House of Representatives passed 2 important bills to improve access to childcare during this pandemic and make the Child and Dependent Care Tax Credit fully refundable so working families can get the benefit. I know that American families have been hard hit by this pandemic, and it's unacceptable that families without childcare options are forced to choose between keeping their jobs and keeping their children safe. I am also a proud co-sponsor of the bipartisan IDEA Full Funding Act to fully fund the Individuals with Disability Education Act. Congress passed IDEA nearly 45 years ago to ensure children with disabilities get the care that they need and a quality education. But the federal government has failed to adequately fund its share. This must change. And as we continue to address the COVID-19 pandemic that has impacted families across America, it's time for the United States Senate to take a vote on the HEROES Act, important legislation to support children, working families, and schools that the House passed nearly 4 months ago. This pandemic isn't taking a pause, and neither should the United States Senate. The HEROES Act includes crucial funding to strengthen food assistance for our families and children, as well as funds our schools to safely reopen, equipment for distance learning, and to offset those budget shortfalls. Passage of the HEROES Act is long overdue, and I'm thankful for your partnership in advocating for this critical legislation to ensure a bright future for all our children. It's time to invest in our children now. And I want to thank you again for allowing me to share a few words with you. As always, I'm full of incredible feelings, I guess I should say. I can't get the words out. And thankful for your partnership. It's really something to see the advocacy and how it comes together and how it provides that inspiration to each and every one of us. So thank you for your incredible action, activity, and inspiration in making sure that we're able to fight for our children. So I hope you enjoy the rest of the summit, and I wish you and your families the very best. Thanks again for having me.
Thank you. I definitely ask you a few questions about, love the people of New Mexico and the kids there, and just wondered, as you're talking to people in the state, I know you're running for the Senate, and so you're all over the entire state. How are you? What kinds of things are you hearing from the people in New Mexico? Like, what are their big issues? And if you were to win, which what would be some of your priorities as you enter the U.S. Senate in the next term?
Well, the high cost of childcare and healthcare are two of the most pressing issues that I hear from my constituents. Families are struggling to make ends meet. They've been hit hard by COVID-19, and the burden of these costs make families forego other necessities as well as opportunities for their children. So investments in education and educational tools are other concerns I hear about often. And in New Mexico, students in rural and tribal communities face a digital divide that prevents them from engaging in distance and digital learning. That has to change. So the Moving Forward Act, which is the infrastructure package recently passed by the House of Representatives, includes several pieces of legislation that I introduced to spur the deployment of broadband to these communities, equip our school buses with Wi-Fi, and advance digital equity. So the Senate needs to act on the Moving Forward Act. It's an important investment to help students to make investments with our schools, modernize our schools. And the legislation would allow child care programs to reopen or remain open in the midst of the pandemic and make critical improvements to facilities to keep staff and families safe. What families are concerned about most is how, especially during COVID-19, can they count on more federal support to make a positive difference in their lives, especially with the pain that everybody's feeling in the face of COVID.
That's great. Our one thing I wanted to tell you is here at our budget summit, one of the things we're releasing is that the fact that the federal share of spending for kids has dropped to 7.48% of the federal budget, and kids are about a quarter of the population. So the share of spending since the last year of the Obama administration in 2016 has dropped by 9%. So first, do you believe the share of spending on children is adequate? And if not, how can we reverse this trend and ensure children are a priority in the federal budget process?
Well, first off, that statistic is simply unacceptable. Investing in our kids is the best decision that the federal government and any government can make. And yet we've seen the challenges that have been hit with federal spending. That has to change. The president's budget proposal further slashed it for fiscal year 2020, a decision that's hard to stomach at a time when children need this support the most. So I was proud to vote for the Child Care is Essential Act and the Child Care for Economic Recovery Act to stabilize the child care industry and make the child and dependent care tax credit fully refundable for working families. That would help so many, and it would lift so many in New Mexico out of poverty. Child care providers support our families, businesses, and the economy. And I was proud to join Representative Clark in sending a letter to the Senate urging them to include both bills in the next COVID-19 relief package. Investing in children is more important than ever during the public health emergency. Medicaid and SNAP are the largest sources of federal spending on children, and young children in particular rely on those dollars to ensure that families put food on the table and keep them safe during this pandemic. Further, the HEROES Act included additional funding for these programs and increased cash assistance to families. That's why it's so critical for the White House and Mitch McConnell to act and pass the next COVID-19 relief package now. The pandemic is taking a pause, and again, neither should the Senate nor Congress. This is so important to pass. So again, it's going to take real action and real leadership to be able to get these levels of funding where they should be and making these investments in our kids, which are our future.
For the child advocates across this country, I just wanted to highlight that this is you really demonstrate what makes a champion for children. You talked on this call about childcare, about education, about COVID relief, just on a whole variety of issues. You've been such a huge champion, and like I said earlier, the healthcare bill we worked with you on, and one of the other great things in it is that that outreach enrollment grant program that you really improved on, and that we worked really closely with you. In the COVID relief package, another thing to highlight is that that would have been made permanent, and so yet another reason why the HEROES Act is so important to happen. And so just any on kinds of issues around. I know another big issue in New Mexico, and I just want to give you the opportunity to talk about it, is child poverty. And is there any kinds of things that you think that we should be focused on there that we can work with your office on?
Well, making permanent and expanding the child tax credit would help lift more families out of poverty than I think any one action that could be taken in this particular space. That needs to happen. And again, closing this broadband divide gap. Here in New Mexico, we get hit hard. And as you know, in rural and tribal communities across America, this digital divide is real, and it's always existed. But now during COVID, we've seen how families have been hit hard. So passing that and making it permanent and expanding the child tax credit, which would lift, I think it's been estimated as many as 30% of families out of poverty in New Mexico alone. And then closing that digital divide with investments in our kids as well. And then also, one of the other areas that I've been working on, which is making sure that when kids are in school, that they're not hungry. I mean, how many of you, you get grouchy and you're not happy when you don't have that morning coffee? Can you imagine if you didn't have a meal, or maybe meals for the day? We need to make sure that we're also feeding our kids so that they're strong and they're ready to learn, and that they have all that nutrition in addition to those strong programs that are going to help families with childcare. So those are just a few of the ideas that I've been working on, that I've been pushing with our colleagues, and that we could further build more support across the country to ensure that they're going to be adopted and passed.
Thank you, Congressman. Finally, one last question I want to ask you is, you're such a great champion for children, and what we need as child advocates is more people like you who are really making kids a priority in your work. What advice do you have to the children's community, the child advocacy community, to help inspire other members of Congress to help join the fight that you wage every day for kids?
Well, one, just thank you for what you do already. Continue giving a voice to children and families. Parents and educators are our best advocates for children. When they share a child's story, their hopes and their dreams for their child's future, it's incredibly powerful. So be active. Please get to know all of your elected leaders that you've entrusted to be your voice. Make sure that they're working on behalf of children and families when they're taking those important votes, again, that you empowered them to take. And share those stories with them. Make sure that they get to know you and you get to know them. But understand that public sentiment is everything, that we need to build strong support in a bipartisan way across every spectrum. So that way this is a priority, and we can continue to make sure that the federal government's budgets are going to reflect the importance of putting children first and making sure that we're making investments in them and their future.
Thank you so much, Congressman. Thank you for joining us today. We really appreciate it, and hope to continue our great work together on improving the lives of kids, but also the great people of New Mexico. So thank you so much.
Always an honor. Well, just good luck with the rest of your conference, and I look forward to learning more about what you come up with the incredible brain trust that you've assembled.
All right. Thank you so much.
Thank you, Bruce and Congressman Lujan, for such an inclusive discussion of policies important to the healthy development and well-being of our youngest members of society. That does it for this year's virtual Children's Budget Summit. If you have not already, please visit our website at firstfocus.org to download a virtual copy of Children's Budget Book 2020, and please share what you think using the hashtag Children's Budget 2020. First Focus on Children would like to thank the Wellspring Philanthropic Fund, Oak Foundation, GHR Foundation, and the Annie E. Casey Foundation for their generous support. In addition, we would also like to thank the Robert Wood Johnson Foundation and the David and Lucille Packard Foundation for their continued critical support on behalf of children. And finally, thank you to all our terrific guest speakers and their staff, to our fantastic advocacy partners, my wonderful colleagues, and of course, all of you for joining us. Take good care.